Hi, hello, welcome back. Let me ask you, what do you think is the core of OET Speaking roleplay card? Well, I would say that it is the set of tasks which appear in the roleplay card. Now, you have a lot of tasks in the roleplay card, with each task containing a verb, a special verb, we call it as functional verb or key verb, which tells what exactly you need to do. Now, if it's that straightforward, if the candidate knows what is to be done with a specific task, then why is it sometimes challenging? The challenge is the candidate understands what the task means, but they fail to transform or put this task into appropriate phrases or responses. For instance, you come across a lot of tasks or verbs such as reassure, explain, advise, explore, elicit, and so on. Now, the candidate understands the meaning of these verbs, but they sometimes find it difficult how to transform them into appropriate responses or phrases. So in this video, we're going to find out, we're going to explore or we're going to navigate through some of the special key verbs that appear in the OET roleplay cards and what phrases can be used along with these verbs. So let's start. Now here I have categorized the special verbs based on their functionality. Verbs which provide the same function have been grouped under one category. So the category we are going to look at first is requesting information. So mostly when you do role play, not mostly, every time when you do OET speaking, you'll have to request information from the patient. Now, how is this indicated in the role play? In the role play card. So it will be indicated by words such as find out, ask, explore, elicit. All these words indicate that you have to request information from the patient. Okay, I'll show you some example sentence constructions using these verbs so that you get a better idea. For instance, it can appear in the role play card like find out the symptoms of the patient, find out the symptoms of the patient, or ask the patient about the onset of symptoms, or it can be explore the patient's lifestyle habits, or elicit the patient's concern about the proposed treatment plan. Basically, all of these mean that you have to get information from the patient. Now, you understand that, the candidate understands that, but they sometimes struggle in converting these verbs into phrases, appropriate phrases. Now, one thing that you have to keep in mind is that when it comes to OET speaking, it's not just about flaunting your language skills. You have two criteria, that is the linguistic criteria plus the clinical communication criteria. So it's not just about expressing your language skill, but how well you're using it in a clinical setting. That is, the clinical communication criteria assesses that as well. So maintaining a good relationship with the patient is equally important. So bearing that in mind, we know that throughout our speaking, we have to maintain a very polite and respectful attitude towards the patient. So considering that, let's see what are the possible phrases that can be used for requesting information from the patient. For instance, for the first one, find out the symptoms of the patient, you can ask a question like, could you please describe the symptoms you have been experiencing? Does that sound polite? Yes, of course. So what you need to consider here is that you should be sounding polite throughout. So could you please describe the symptoms you have been experiencing, instead of just asking blatantly like, what are your symptoms? Just put it in a very polite way. Now the next one, another way would be for the second task, ask the patient about the onset of symptoms. You can ask like, do you mind telling me when your symptoms started? Again, it's a very polite tone. Then the next one, explore the patient's lifestyle habits. You can say, I would appreciate if you could tell me about your lifestyle. So all these are very polite and respectful ways of asking or getting information from the patient. Or in a very simple way, you can also start something like, may I know when your symptoms have started. So I hope this is clear. When you request information from the patient, the one thing that you have to keep in mind is that you have to maintain a very polite and respectful tone instead of asking it straight on the face. Okay? So that is it with requesting information. Now we shall move on to the next category, that is, check the understanding of the patient. Now, check the understanding of the patient. How does it differ from requesting information? Requesting information basically means you're asking something, or you're asking for something which you totally don't know. You're looking for some new information from the patient. But checking the understanding means whether you're just verifying the patient has already some background information about something. It's ensuring or verifying, not asking. Okay. Now, this is indicated by key verbs such as check, determine, confirm, establish. These key verbs indicate checking the understanding of the patient. Now, I shall show you a few example sentences with these verbs. For instance, determine the patient's knowledge of proper wound care, or check the patient's understanding of medication administration, or it can be confirm the patient's awareness of the throat swab procedure. Now, here if you look through these verbs, the starting verbs which comes at the beginning of these tasks, you can understand that it was not like the previous case wherein you had verbs like explain or explore. No, it is determine, check, confirm, which means that you're just ensuring or verify, not finding out, but cross-checking. Now, in such situations, how you can possibly frame the phrases or responses, let's find that out. For instance, the first one, determine the patient's knowledge of proper wound care. How can we make that into a proper sentence? Grammatically right, it has to be polite, but at the same time, the determine aspect should be reflected in the response that you give. It should not be like asking a question, but rather it should be like a cross-checking or verifying of something which the patient might be knowing. So you can have a response like this. I would like to check if you are aware of the wound care. See, I hope you have understood the difference. You have not asked, do you know, or may I know if you have, may I know whether you know anything about the wound care? No, it's not been asked like that. It has been very explicitly asked that I would like to check if you are aware of the wound care. Okay. Now, the next one, for the second point, check the patient's understanding of the medication administration, how the response has been formed for that. I want to ensure you're clear on when and how to take your medications. Could you please explain it to me? So again, here it has that tone, verifying tone. And now the third one, confirm the patient's awareness of the throat swab procedure. Let's see how the response can be. I would like to verify whether you are familiar with the throat swab procedure. So I hope you understood the difference between requesting information and verifying. Now, in requesting information, you can put it like, may I know, or could you please tell me. But here, if the key verbs are of these form like check, determine, confirm, or establish, you should be reflecting that in the responses that you give. So it will be good if you can frame sentences in the ways which I have shown here, like I would like to check, or I would like to ensure, or I would like to verify, and so on. Basically, the examiner, while hearing your speaking, the examiner should understand that you are just cross-checking it with the patient rather than asking a question. I hope that's clear. Now we shall move on to the next category of verbs. Give information. Just like gathering information, there will be a lot of instances while doing the role play card wherein the nurse will have to give information to the patient. Now this is indicated by verbs such as explain, outline, describe, advise, suggest, recommend, discuss, and so on. Now, while giving information, there can be two possibilities. Maybe the patient would have asked for a specific information and you're giving information on that, or else it's your duty to provide information on a specific aspect and you're giving out information. Now, let's see how sentences, let's look through a few sample sentences using these verbs. Explain the risks involved in self-diagnosis, outline the possible mild side effects, suggest ways the patient can manage the stress levels, advise the patient sunscreen should be applied after steri strips removal. So all of these indicate that you have to give out or you have to provide information to the patient. Now, from the key verbs, you understand that you have to provide information. Now, what we are going to see next is how we'll make them into appropriate responses. Let's see. For instance, for the first one, explain the risks involved in self-diagnosis. How is the response given here? I understand that your symptoms look like a migraine, but self-diagnosis can be risky, Mr. John. Shall I go over the risks involved? Shall I go over the risks involved? Okay, now I'll show you one more. Outline the possible mild side effects. Now, check the response for this one. I would now like to explain to you some mild side effects associated with the vaccine. Is that okay with you? Is that okay with you? You have already said that. I would now like to explain something and you're asking, is that okay with you? Now, did you notice something? In both of these responses, you're taking permission of the patient before giving out information. So that is one thing that you have to keep in mind. When you are providing information, make sure that you seek the permission of the patient before giving out the information. Okay, let's see one more. That is, suggest ways the patient can manage stress level. How is it said? There are several ways to manage stress. Would you like me to suggest some strategies that might help? Here also, would you like me to suggest some strategies that might help? So whenever you're giving out information, just take the permission of the patient that shall I explain or shall I outline so and so details to you, and then go for explanation. I already mentioned that there can be two variations, or the requesting information can come in two forms. Sometimes the patient might have asked for something. In that case, you need not ask for permission. You can say that, okay, I can definitely help you out with that, and then you can proceed with the explanation. But in instances where the nurse has to take the initiative in providing the information, then seek the permission and then proceed with the explanation. Then one more thing that I would like to add on is, for verbs like advise, suggest, recommend and so on, these are kind of tasks wherein you would be asking the patient to follow something or to do something rather than just explaining. What you're looking forward to is, you're looking forward that the patient follows something. Maybe you're talking about how strictly you have to follow a medication, or maybe you might be recommending certain changes in the lifestyle. So whenever you advise, suggest or recommend, you can conclude by saying that, Mr. John, I hope you would be taking my advice into consideration, or Mr. John, I hope you'll be following my advice. So you can wind up such sentences which starts with advise, suggest and recommend in that way. You're asking the patient to do something or follow something. So just check with the patient that he or she would be doing the same or following the same. Now, when it comes to giving information, another aspect of it is that you might have noticed in some role play cards this word, resist. Now, what do you mean by resist? Resist means opposing something. Resist giving information. So this is a situation where the patient would have asked for specific information, but it does not, maybe because that it's not something which comes under your responsibility. So you're not in a position to give out answer for that question. So how you'd be responding for that? You should not say a blatant no to the patient. There also, you have to maintain a very respectful attitude towards the patient. I'll show you a sample sentence. For instance, in the role play card, you can see something like, resist providing details about the recovery timeline. Maybe the patient is worried and the patient would have asked, okay, how long will it take for me to get back to my normal life? And the task in your role play card would be resist providing details about the recovery timeline. So you cannot definitely say that, no, I cannot say that. But instead, somehow you have to manage it. So let's see how this can be managed. See the response. I understand your concern. That is the first thing. The first thing is that when the patient raises a concern, you need to acknowledge that. Whether it's your role or not, the patient should feel that, okay, his or her concern is being acknowledged. So you say that I understand your concern and you don't have to worry. You're just giving that reassurance, making the patient feel comfortable. I understand your concern and you don't have to worry. That's not just enough. You should provide some alternative to it also. And what you have to say, the doctor will be here shortly for his rounds to update the details. So you're saying that like, okay, I acknowledge what you have said, but it's not something which can be done from my end, but you don't have to worry. The doctor will be here shortly for his rounds, and then you can ask him the details. He'll update you with the details. That's how you have to deal with resist. I hope that's clear. Now we shall move on to the next category. Change the patient's mind. You might have noticed situations where a patient is resistant or reluctant to a specific idea. Maybe you're going to start a new therapy, but the patient might not be willing for that. Or maybe the patient has been posted for surgery, but the patient is worried and anxious and he does not want to undergo that procedure. So in such situations, how will you handle it? And such changing the patient's mind is indicated by verbs such as persuade, emphasize, stress, reinforce, convince, promote. All these indicate that you have to change the patient's mind. You have to convince the patient for a specific thing. Maybe it can be starting a medication or a procedure, whatever it is. You are to convince or change the mind of the patient. Now I'll show you sample sentences that might appear in the role play card. For instance, it can be emphasize the need for taking medications as prescribed, or it can be reinforce the need for regular follow-ups, or it can be convince the patient to quit smoking for better health, persuade the patient to consider a healthy diet. So all of these indicate that now the patient is resistant to this idea, but you have to, through your communication, you have to change the patient's mind, convince the patient for to do something which you are suggesting. So let's see how you can do that. The first one, emphasize the need for taking medications as prescribed. So how this has been done? You can say, one way in which you can say this, it is really important to take your medications as prescribed to help with your recovery. So what you notice here is that you are stressing the importance of why the medications have been prescribed. So you say that it's really important to take your medications as prescribed to help with your recovery. So you're not just telling that it's important, but you're giving a justification for the same. So whenever you have to change the patient's mind, you have to make the patient understand the importance of it. Why is it necessary? And give the reason. So that is more convincing. Now let's look at the second point. Reinforce the need for regular follow-ups. How can this be said? Please make sure to attend your follow-up appointments so we can monitor your progress. So first you're saying, make sure to attend your follow-up appointments. Why? You're giving the reason. So we can monitor your progress. Now one more, let's see one more. The third one, convince the patient to quit smoking for better health. Now let's see the sample response. I would ask you to think about quitting smoking. I would ask you to think about quitting smoking because it can improve your overall health and reduce the risk of serious diseases. Here also you are making the patient understand the importance of quitting smoking and telling the reason how it's going to benefit the patient. So when you do these tasks or tasks which contain verbs wherein you have to change the patient's mind, one thing that you have to keep in mind is that you need to have that serious tone. Okay, of course you have to be polite, but then to make the patient understand the seriousness of it, you need to sound serious. For instance, if you're telling the first response, see Mr. John, it's really important to take your medications as prescribed to help you with your recovery. That seriousness should reflect in your voice. After all, it's your voice that is being reached to the examiner. So whatever you're trying to convey should be reflected in your voice. So whenever doing tasks wherein you have to change the patient's mind, make sure that you reflect that seriousness. Okay. Now moving on to the next category, make the patient feel better. Now we know that the patients might have a lot of concerns. They might be worried about the procedure they are going to undergo, or they might be worried about a disease condition that they have been just diagnosed with. In all of these conditions, like, you will have to make the patient feel better. So such tasks are indicated by verbs starting with allay, reassure, encourage, empathize. These indicate that you have to make the patient feel better. Okay, I'll show you a sample sentence, some sample sentences. Allay concerns about surgery, which means that patient is worried about the surgery, and so you have to make the patient feel better regarding it. Reassure about medication side effects. Empathize with the patient's anxiety about the test results. Encourage physical activity. Now, all of this indicate that you have to make the patient feel better about something which they are already worried about something, and you have to make the patient feel better. Now, let's see how we can make sentences out of these. For the first one, allay concerns about surgery. We can say that, I understand your concerns, but this is a routine procedure and we will ensure your safety. So here also you can say that, okay, when the patient expresses his worry, you should not say that, oh, there's nothing to worry. No, you have to make the patient feel that, okay, you empathize with him or her, you understand his or her condition, and then give assurance. Then make the patient feel that you are there with the patient. So first thing is that you tell, okay, you acknowledge, I understand your concern, but this is a routine procedure and we will ensure your safety. Okay. Now let's look at the second one. Reassure about medication side effects. So how this has been said, I completely get why you're worried. Again, you're acknowledging here, and then what you're saying, but I want to reassure. Then you're giving the assurance. So it goes like, I completely get why you're worried about the side effects, but I want to reassure you that most side effects are mild and temporary, and we are here if you need help. So that's how it goes. When you have to make the patient feel better, first thing is that you have to acknowledge their concern and then give them the solution. So when you're doing this, the one thing that you have to make sure that you need to have that empathetic tone. You need to sound empathetic. The patient should feel that you are there with the patient. Okay. Now one more. The third one, empathize with the patient's anxiety about the test results. So how can we say that? I know this is difficult. You acknowledge that, you say that you empathize with the patient, saying that I understand that this is difficult, but we will do our best to keep you comfortable. You're giving the assurance there. Okay. So I hope it's been clear. Now we have gone through an extensive list of tasks which appear in the OET role play cards and the possible phrases or responses that you can give for such tasks. And I hope that you would be incorporating the same in your OET speaking. So stay tuned for more such videos. Thank you.
Medcity International Academy. Trusted hands forever.